In this video, we will show you how to use a naloxone kit in the event of an overdose. If someone has overdosed, a naloxone kit can be used to save them. You can get a kit from a specially trained pharmacist without a prescription, but it may not be covered by your medical insurance unless your doctor writes an order. Naloxone is also known by the brand name Narcan. What does an opioid overdose look like? 3 strong signs of overdose are tiny, pinpoint pupils, slow and shallow breathing, and/or the person won't wake up. If you think someone is having an overdose, here's what you need to do. 1. Try to wake the person up. 2. Call 911. 3. Give the first dose of naloxone. 4. Check for breathing. And 5. Be prepared to give a second dose of naloxone if needed. Make sure to stay with the person until help arrives. Step 1. Try to wake the person up. Shake them and shout. If there is no response, grind your knuckles into their breastbone for 5 to 10 seconds. Step number 2. Call 911. Make sure that help is on the way. Step 3. Give the first dose of naloxone. There are 3 common ways to give naloxone: nasal spray, nasal atomizer spray, or by injection. If you are giving naloxone using nasal spray, peel the package open and hold the device. Do not press until ready to give naloxone. Place the tip in the nostril, and then press the button firmly. The naloxone nasal spray works even if the person is not breathing. If you are using a nasal atomizer spray, pull off the safety caps. Screw the pieces together, but do not press until ready to give naloxone. Spray 1/2 of the medicine into each nostril. The naloxone nasal atomizer spray works even if the person is not breathing. If you are giving naloxone by injection, flip off the cap to reveal the latex seal on the top of the bottle. Turn the bottle upside down and pull the plunger on the syringe. Inject into muscle such as the shoulders, thighs, or buttocks. Push the plunger all the way down. After you give the person the dose of naloxone, check for breathing. If the person is not breathing, give them CPR if you have been trained, or do rescue breathing. To do rescue breathing, tilt the head back, open the mouth, and pinch the nose. Start with 2 breaths into the mouth. Then, give 1 breath every 5 seconds. Continue until help arrives. If you do not have naloxone, a person in overdose who is not breathing may be saved with rescue breaths while help is on the way. Finally, you should be prepared to give a second dose of naloxone if needed. How can you tell if the naloxone is working? If someone is experiencing an opioid overdose and is given naloxone, they should wake up in 2 to 3 minutes. If the person does not wake up in 3 minutes or loses consciousness again, give them a second dose of naloxone. Whether you give the person a second dose of naloxone or not, turn them on their side to prevent choking. Be sure to stay with the person until help arrives. Again, if someone is having an opioid overdose, or even if you think they're having an opioid overdose, here's what you need to do. Try to wake the person up. Call 911. Give them their first dose of naloxone. Check for breathing. Be prepared to give a second dose of naloxone if needed. And stay with the person until help arrives. How do you know when to use naloxone? If you think someone is experiencing an opioid overdose, it does not hurt to give naloxone. Naloxone reverses the effects of opioids such as heroin, methadone, morphine, opium, codeine, or hydrocodone. It does not reverse the effects of other types of drugs like alcohol or stimulants like cocaine. If the person has mixed drugs and an opioid is involved, the person will likely start breathing but continue to be sedated from the other drugs. Can naloxone be harmful? Serious side effects of naloxone are very rare. The most common side effect is opioid withdrawal, since naloxone reverses the effect of opioids. Common opioid withdrawal symptoms include aches, irritability, sweating, runny nose, diarrhea, nausea, and vomiting. It's most important to give someone naloxone if you think they are experiencing an overdose, because it can save them from brain damage or even death.